You're bleeding or burning, or something inside you decided that existing is optional and now every breath feels like a rusty knife running through your nerves. The hospital is 3 days walk away. Your imaginary morphine won't save you, and that ibuprofen you kept in your backpack expired in 2019 and now it's basically dust of broken hope. So here you are, alone, injured, and about to learn that the human body comes with shutdown buttons that nobody taught you to press. Spoiler, some of them work. Others will make you wish you'd studied anatomy instead of watching shows about serial killers. Hit the damn like button, not because I need algorithmic validation, although I do, but because if you survive this, you'll want other people to suffer with knowledge too. Comment something sarcastic. Subscribe if you want to learn more creative ways not to die when the world decides you're disposable. And before we begin, there's something almost nobody knows about extreme pain. Something military doctors discovered on battlefields that will completely change how you approach the next steps, but it only makes sense after you understand the basics. So hold that information in the back of your head while I teach you how to hack your own nervous system. Step 1. Compression isn't a hug. Crush the pain before it crushes you. Compression is the art of turning human tissue into a homemade hydraulic press. Sounds violent, because it is, but it works. When you squeeze an injured area, you're literally suffocating the pain signal before it reaches the brain. It's like cutting the internet cable of your own suffering. The science is cruel and simple. Pressure receptors are faster than pain receptors. They arrive first, occupy space, and when pain tries to pass, it finds a giant queue of busy. Try again later. Gate theory, gate control theory. Melzack and Wall discovered this in 1965, probably while torturing volunteers in the name of science. How to do it? Find the epicenter of pain. Not the place where it hurts most, the place from where pain radiates. Could be a point. Could be a line. Could be an area the size of your palm. Press. Don't massage. Don't caress. Press. Use the base of your palm, not your fingers. Fingers get tired. Palm endures. You want 70% of your maximum strength. Imagine you're trying to leave a permanent mark on the universe through your own flesh. Hold for 30 seconds. The pain will protest. Ignore it. It always protests. It's literally its job. Release slowly. Very slowly. As if you were disarming a bomb made of nerve endings. If the area is swollen, compress around the swelling, not over it. Think of yourself as a cruel butcher surrounding the problematic meat, redirecting blood flow like a sadistic human traffic engineer. Visual comparison. It's like squeezing a water hose while it's on. The pressure interrupts the flow. Except here the water is an electrical signal of agony crossing your nervous system at 120 meters per second. You are the hand, your body is the hose, and the faucet is in hell. Real risk. Compress too much, and you cut circulation. Tissue without blood dies. Necrosis is silent and treacherous. You won't notice until it's too late. If your skin turns bluish, cold, or starts to look like melted candle wax, you've crossed the limit. Release immediately. Choosing between pain now or amputation later is easy when you put it in those terms. Compress a main artery and you have 3 minutes before permanent damage. 7 before irreversible cell death. There's no timer here. Just your bad decisions and relentless biology. Impact phrase. Compression is negotiation. You offer pressure. Your body offers temporary silence, but like every negotiation at the end of the world, there's always fine print written in blood. And here's a secret you'll need later. There is a specific point in the human body where compression not only relieves pain, but can shut down consciousness completely in 8 seconds. You'll learn where it is, but not yet. By the way, since we're talking about emergencies you hope to never face, but probably will, I've put together a complete video on how to survive a prolonged blackout. When electricity becomes a distant memory, it's in the first pinned comment. Check it out if you want to expand your repertoire of things that keep you alive when civilization takes a day off. Step TWO. Heat and cold are chemical warfare. Burn or freeze. But choose wisely. Temperature is language, and pain is conversation. When you apply extreme heat or cold, you're basically screaming louder than the pain, forcing your nerves to pay attention to something else. It's sensory manipulation. It's neural propaganda. It is you hacking an operating system billions of years old with ice cubes and a hot water bottle. Heat dilates blood vessels, increases flow, relaxes muscles. It's biological seduction. Everything becomes soft, slow, distracted. Works for muscle pain, cramps, chronic tension, anything that is tightness. Cold does the opposite. Constricts, paralyzes, kills sensation like an efficient assassin. Works for acute inflammation, swelling, recent trauma. Anything that is screaming, how to do it, heat. You don't have a heating pad. You have creativity and desperation. Hot water bottle. Boil water obviously. Put it in a resistant plastic bottle. Wrap it in fabric. Never against bare skin. You want heat. Not second-degree burns. Heated stones. Find smooth stones. Heat them near the fire, not in the fire. Unless you want a thermal grenade. Wrap in cloth. Apply. Sand. Salt heated in fabric. Works surprisingly well. Retains heat like a miser retains money. Apply for 15 to 20 minutes. More than that in your cooking tissue, not treating it. Cold. Improvise as if your life depended on it, because it might. Ice in plastic bag wrapped in cloth. Never directly on skin. Frostbite is real and relentless. Cold water in bottle. Works. Not sophisticated. Works anyway. Cold mud. Dirty. Primitive. Effective. Wrap the area. Let it partially dry. Remove, if in cold environment. Snow in fabric. Nature. Offering free anesthesia. Apply for 10 to 15 minutes. Never more than 20. You want anesthesia. Not freezing. Visual comparison. Heat is a drunk blanket suffocating your pain until it falls asleep. Cold is a professional assassin injecting paralytic into your nerves until they simply give up reporting anything to headquarters. Real risk. Heat. Second-degree burns are painless at first because they destroy the very nerves that would feel the pain. You'll notice when blisters appear. Infection loves blisters. Sepsis loves infection. You understand the progression. Cold. Frostbite starts as tingling, evolves to numbness, ends in necrosis. Your fingers will fall off like autumn leaves if you don't respect the limits, and unlike leaves, fingers don't grow back. Alternating heat and cold too quickly causes thermal shock. Blood vessels don't know whether to dilate or constrict. They choose both, simultaneously. Vascular rupture is silent until it's not anymore. Impact phrase. Temperature is a lie you tell your nerves. And like every good lie, it works perfectly until the moment it doesn't anymore, and then you're burned, frozen, or both. Remember that secret about compression. The point that shuts down consciousness? Combined with extreme cold in the right place, you can induce something like total anesthesia. Field doctors did this in wars. You'll do it in the apocalypse. But first you need to understand body positions. Step 3. Gravity is your treacherous ally. Position yourself, or suffer the consequences of physics. Pain doesn't exist in a vacuum. It exists in a body that's subject to gravity, pressure, muscle tension, and your terrible sense of ergonomics. By changing how you position yourself, you change how pain expresses itself, sometimes dramatically, sometimes catastrophically. Elevating the injured area above the heart reduces blood flow. Less blood, less swelling, less pressure on nerves. It's drainage by gravity. Let the universe do the heavy lifting while you just exist higher. Natural compression positions. Use the body's own weight to press strategic points. You become both the problem and the solution. It's philosophical and practical. How to do it. For limbs, arms, legs, elevate. Whenever possible. Above the heart is ideal. Use bags, backpacks, rocks, logs, anything that creates height without collapsing. If it's an arm, wrap a sling around your neck. Improvise with belt, rope, fabric strips. Keep elbow at 90 degrees. You want support, not accidental hanging of your own limb. If it's a leg, lie down. Elevate leg on raised surface. 30 to 45 degrees is enough. More than that and you're just doing yoga with trauma. For abdominal pain, modified fetal position. Lie on your side. Pull knees toward chest, but not completely. You want relief, not compression of internal organs until they scream louder. Pillow support between knees reduces tension in lumbar spine. Your abdominal pain might be referred muscle from your back. The body is a creative liar. For back pain, 90 to 90 position, lying down, thighs perpendicular to floor, calves parallel to floor, legs bent at 90 degrees. Use chair, box, backpack for support. Eliminates load on lumbar spine completely. Alternative, lie completely horizontal. Place support under knees. Align spine. Reduces discompression. Simple, brutal, effective. For anything in head, neck, cervical support. Roll towel, fabric into sausage shape. Place under neck. Maintains neutral cervical alignment. Prevents muscle spasms that make everything worse. Slight head inclination 15 to 20 degrees can reduce intracranial pressure if you have trauma. It's not cure, it's crisis management. Visual comparison. Imagine tubes full of pulsing red liquid connected to sensitive flesh balloons. Now imagine you can reorganize these tubes so less liquid reaches the problematic balloons. It's human hydraulics. It's improvised vascular engineering. It's you playing Tetris with anatomy. Real risk. Elevating limbs with unstabilized fractures can displace broken bones, bone fragments. Move. Puncture arteries. You bleed internally while congratulating yourself for following instructions. Prolonged fetal position compresses lungs. Shallow breathing leads to hypoxia. Hypoxia leads to confusion. Confusion leads to decisions that end in short, ironic epitaphs. Sleeping in pain relief position can mean waking with muscles in spasm because you stayed too immobile. The body punishes prolonged comfort. It's cruel that way. Impact phrase. Gravity doesn't care about your pain, but you can negotiate with it using angles. Elevation and the deep irony that sometimes the best position to feel nothing is the one that seems most uncomfortable. Now about that magic compression point. It's in the neck, and when you combine precise compression, concentrated cold, and the right body position, you can induce something close to controlled fainting. But that's advanced material. Let's continue with the basics first. Step for pressure points are acupuncture. Without the mysticism asterisk, find the buttons, press them, pray they work. Your body is a map of points that, when pressed, send signals that confuse, distract, or simply scream louder than the original pain. It's not magic. It's poorly understood neurology that works regardless of whether you believe in it or not. There are pressure points documented for millennia. Traditional Chinese medicine called them meridians. Modern science calls them confluences of superficial nerves that are inexplicably sensitive. Both agree. Press here. Something happens there. How to do it. Leave for HEGU, for headache. Facial pain, general pain. Locate, between thumb and index finger, in the fleshy part of the hand. Feel the muscle. Now press deep, toward the index finger bone. Technique, use thumb of other hand. Firm and constant pressure, as if you were trying to punch through your own hand. 30 to 60 seconds, alternate hands if pain is bilateral. Expected sensation, localized pain that radiates slightly if it doesn't hurt when you press. You're in the wrong place or you're a robot without functional nerves. Warning for pregnant women, this point can induce contractions. Nature is dramatic that way. Avoid completely. PC6 Naguan, for nausea, anxiety, chest pain. Locate, 3 fingers below wrist crease, inner side of forearm, between the 2 prominent tendons. Technique, use thumb, press directly downward, toward the center of the arm, 1 to 2 minutes. Deep breaths optional but recommended. Works mysteriously well for nausea. Science doesn't fully know why. Use it anyway. GB20 Fenki, for headache, cervical tension. Locate, base of skull, to symmetrical points where neck meets head. In small depressions on each side of spine. Technique, use both thumbs simultaneously. Press upward and inward, as if trying to push through the skull toward the eyes. Tilt head slightly backward, 1 to 2 minutes. Sensation, immediate relief or radiating pain that gradually transforms into relief. The body decides which. SD36 Zusanli, for abdominal pain, digestion, energy. Locate, for fingers below kneecap. 1 finger width lateral to tibia shin bone, in fleshy part of leg. Technique, press with thumb or knuckles. Firm circles, 1 to 2 minutes each leg. Called the longevity point in traditional medicine, not because it makes you live forever, but because it keeps you functional when everything is falling apart. Li 11 Kuchi, for arm pain, fever, inflammation. Locate, bend arm completely. The point is at the end of elbow crease, outside. Technique, press with thumb of opposite hand. Keep arm slightly bent. 1 to 2 minutes, reduces inflammation in ways that defy simple explanation. Use it and thank me later. Visual comparison. Imagine your nervous system as an old control panel full of buttons. Most do nothing useful. Some do random things, but there are some specific buttons that, when pressed in the right sequence, with the right force, temporarily reprogram your experience of physical reality. You're looking for those buttons in darkness with trembling hands. Real risk. Press the heart on points over arteries and you can cause vasospasm. Artery closes. Tissue beyond it doesn't receive blood. Ischemia is silent until it's permanent. Some pressure points near joints can, if pressed aggressively, cause displacement of underlying structures. Tendons slip. Nerves compress. Your attempt at relief becomes secondary injury. And that point in the neck I mentioned? It's dangerous for a different reason. It's not mystical. It's the carotid artery. Press wrong and you have syncope, sudden fainting because the brain doesn't receive blood. Press very wrong and you have stroke. So when I teach you this point, you'll pay attention as if your life depended on it. Because it might. Impact phrase. Pressure points are neurological lottery. Sometimes you win relief. Sometimes you win nothing. And occasionally you win a brutal lesson about why anatomy should be mandatory discipline in the apocalypse, and since we rate talking about knowledge you hope to never need but should have. Anyway, the video about surviving prolonged blackout is in the first pinned comment. Covers everything from potable water to improvised refrigeration. Because apparently you like being prepared for when everything goes wrong simultaneously. We're getting close. You already know how to compress, heat, position, press. Now comes the part where you learn to combine all of this into protocols that actually save you when pain is trying to kill you. Step 5. Combination protocols. When everything together works better, layers of relief or layers of error. Choose wisely. Nothing you've learned so far works in isolation as well as it works combined. Compression plus cold, position plus heat, pressure points plus elevation. You're building an architecture of relief, brick by brick, all stacked on the unstable foundation of your own suffering. But wrong combinations cancel benefits. Worse, they create new problems. Heat on acute inflammation makes everything worse. Cold on tense muscle lock spasm. You need logic, sequence, timing. You need to think while every nerve ending screams that thinking is optional. How to do IT. Protocol 1. Acute trauma, less than 48 hours. Objective, reduce inflammation, control swelling, prevent worsening. Sequence, elevate affected area immediately. Apply cold 1015 min. Remove, wait 30 minutes. Moderate compression around not over-traumatized area. Maintain elevation whenever possible. Repeat cold every 2 to 3 hours while awake. Useful pressure points. Li11 if there's inflammation. SD36 if it's lower limb. Never. Heat in the first 48 hours. You're feeding inflammation like throwing gasoline on fire. Protocol to muscle pain. Cramp. Objective. Relax tissue. Increase flow. Eliminate spasm. Sequence. Position muscle and slight stretch not maximum. 60 to 70% of maximum. Apply heat. 15 to 20 minutes. Gentle compression during heat application. Press leaf if upper body. Saint 36 if legs. Gentle movement. After heat is removed, activates blood flow. Never force stretching before warming. Cold muscle fiber is fiber that tears. Protocol 3. Severe headache. Objective. Reduce vascular pressure. Relieve cervical tension. Distract nervous system. Sequence. Position. Lying down. Head slightly elevated 15 to 0 degrees. Cold compress on forehead. Temples 10 minutes. Simultaneously. Pressure on GB20 base of skull. After removing cold, pressure on leaf for 1 to 2 minutes each hand. If it persists, warm compress on nape nod forehead for 10 minutes. Alternative, if it's migraine with visual aura, skip heat completely. Cold plus darkness plus silence plus GB20 pressure. Protocol for abdominal pain non-traumatic. Objective, relax smooth musculature. Reduce gastrointestinal spasm. Sequence. Modified fetal position left side is ideal for digestion. Heat on abdomen 15 to 0 min. Pressure on SD36 bilaterally. Deep diaphragmatic breathing during heat application. If menstrual cramp, add pressure on Li4. Never. If there's fever, blood and stool, acute abdominal rigidity. These are signs of go to hospital immediately disguised as maybe I'll survive this. Protocol 5. Joint pain knee, ankle, wrist. Objective, reduce swelling, stabilize. Maintain minimal mobility. Sequence, elevate joint above heart. Cold 1015 min. Wait 30 minutes. Repeat. Compression with bandage. Fabric firm but not circulation restrictive. Partial immobilization. Support that allows minimal movement but prevents instability. Proximal pressure points X if knee. Work Street 36 and Li11. Movement. Gentle and within tolerable range. Complete immobilization causes stiffness that worsens everything. Visual comparison. It's like orchestrating a symphony where each instrument is a different form of torture that, when combined correctly, creates something close to silence. But if you miss the timing, volume, or order, you just have neurochemical cacophony. REAL risk. Protocols to long without reassessment can mask worsening. You're so focused on following the procedure that you don't notice the wound is infected. Swelling tripled or you develop compartment syndrome. Combining heat plus tight compression is recipe for pressure burn. Tissue cooks under tight bandage. Literally, smell and everything. Alternating protocols randomly without reason. Confuses body's response. Nervous system gives up interpreting signals. You reach sensory saturation where nothing works anymore because everything is working simultaneously. Impact phrase. Protocols are recipes written in desperation and tested on real flesh. Follow to the letter or improvise intelligently, but never do both at the same time. And now yes, that dangerous point in the neck. What closes all open loops? The secret field doctors don't like to admit exists. Step 6. The forbidden point and the truth about extreme analgesia when everything fails. There's a red button, but it comes with a price. Let's be direct. There's a point in the human body where precise pressure, applied correctly, can induce loss of consciousness in seconds. It's not mysticism, it's not urban legend, it's baroreceptor reflex of the carotid sinus. And it's as real as heart attack. The carotid artery runs through the neck. In it there's a structure called carotid sinus, a blood pressure sensor. When you press this point, the body thinks your blood pressure is dangerously high. So it does what any poorly designed biological system would do, reduces blood pressure drastically. Heart slows, vessels dilate, brain receives less blood, and you black out. Why this matters? In extreme pain, compound fractures, third-degree burns, catastrophic abdominal trauma, when you have no morphine, no hospital, nothing. But you in the indifferent universe, this technique is the last frontier, not for casual use. For emergencies where pain is so severe that losing consciousness temporarily is preferable to staying awake, military doctors use variations of this. Martial arts practitioners know it as blood choke. You'll know it as the thing you should never need to use but might. How to do it and why you probably shouldn't. Location: neck. Approximately 1/3 of the distance between ear and clavicle. Slightly anterior frontal to the sternocleidomastoid muscle. That thick muscle that appears when you turn your head. Technique only in life or death. Situation: person needs to be sitting or lying down, never standing. You'll understand why in seconds. Use thumb or 3 fingers together. Press firmly but not brutally. You want to compress artery, not crush adjacent trachea. Bilateral both sides is more effective, but also more dangerous. Sustained pressure for 5 to 10 seconds. Loss of consciousness is almost immediate if done correctly. Release immediately as soon as person loses consciousness. Recovery is generally in 10 to 20 seconds. Modification with cold. Applying intense cold to carotid points for 30 to 60 seconds. Before pressure can potentiate effect. Vasoconstriction plus pressure equals multiplied effect. Use only if absolutely necessary. When to consider: compound fracture that needs to be reduced. Bone relocated without anesthesia. Severe burns that need to be cleaned, treated, and pain is unbearable. Emergency procedures where person needs to stay absolutely immobile. Pain so extreme that risk of shock is imminent when never to do. Elderly person stroke risk multiplies. History of heart problems. Known or suspected atherosclerosis. Any other option is available. You're doing this out of curiosity or test visual comparison. It's like shutting down a computer by forcing the power button instead of doing normal shutdown. Works, solves immediate problem, but there's risk of system corruption, data loss, and occasionally literal fire. Real risk: sudden cardiac death. Rare but possible. Exaggerated. Vagal reflex to heart. Asystole: you tried to help and killed someone. Stroke: if there's atherosclerotic plaque in carotid, pressure can dislodge it. Embolus travels to brain. Person wakes with half body paralyzed, or doesn't wake. Fall and secondary trauma. If person is standing or in unstable position. Loss of consciousness means uncontrolled fall. Head trauma. Cruel irony of causing injury while trying to relieve another. Tracheal damage. Press in wrong place or to heart and you crush airway. Asphyxiation is terrible way to correct pain. Why I taught you this? Because knowledge is tool. And tools can build or destroy depending on who wields them and how. You got here learning compression, temperature, position, pressure points, combined protocols. All of these are layers of defense against pain when the modern world isn't available. They're techniques that, used correctly, can mean difference between enduring and succumbing. This last technique, the carotid point, is what you use when all other layers have failed and you're looking at choice between pain that can kill via shock and temporary loss of consciousness that can save. Impact phrase: it's like having a grenade. You carry it. You hope to never need it. But if you need it, you'll know exactly where the pin is and what happens when you pull it. You're still alive, probably, so here we are, end of the line. UV absorbed what amounts to field medicine written as survival manual for people who refuse to die quietly. Compression that crushes signals before they reach the brain. Extreme temperature seducing or paralyzing nerves into submission. Gravity reorganizing human hydraulics. Pressure points transforming body topography into neurological command keyboard. Protocols that orchestrate all of this into sequences that make sense when nothing else does. And in the end, the wild card, a point in the neck that shuts down consciousness when pain is worse than temporary absence of existence. You learn because you asked, or because you clicked, or because the algorithm decided you needed to know how not to die in agony. When aspirin is distant memory and hospitals are fantasy. Will you use these techniques? Maybe. Probably not. Possibly in moments where alternative is letting pain win. And when you use, if you use, you'll remember that each method here is negotiation. You offer pressure, temperature, position, time. Your body offers temporary relief and risk of permanent complication. It's exchange. It's always exchange. Pain is language the body speaks when it wants attention. You just learn to speak back. Sometimes gently, sometimes screaming. And occasionally with technique that could kill if you don't know what you're doing. All open loops closed, knowledge transferred, responsibility is now yours. You're equipped to suffer less or suffer differently or cause new suffering trying to avoid the original. Choose wisely. The body forgives many things, but not everything, never everything. Last thing before you go, if this was useful, bizarre, or terrifying in just the right measure, share it with someone who also needs to know how to hack their own nervous system in the apocalypse. If it was offensive, too sarcastic, or morally questionable, well, you still read to the end. That counts as victory. Now go, live, suffer less when possible, and remember, improvised analgesia isn't real medicine. But when real medicine doesn't exist, improvisation is all you have, and sometimes, it's enough.